I'm about to share something with you that sounds almost too simple to matter. And yet, I've watched it change lives. Not a surgery. Not an expensive treatment. Not another prescription added to an already crowded pill organizer. Just one small, daily habit, done consistently, that can help your blood vessels function better, improve circulation, and warm those feet that always feel like ice. And the surprising part? Most people already have it sitting in their kitchen. Now before you roll your eyes and think, if it were that simple, my doctor would have told me, I understand that reaction. I truly do. But here's what I've learned after years of working with patients struggling with circulation problems: we are very good at managing advanced disease. We are not always good at supporting the biology underneath it. Poor circulation isn't just about clogged pipes. Your arteries are living, breathing tissue. They are lined with delicate cells that produce substances that allow your vessels to relax and widen. When those cells become inflamed, stressed, or damaged, your arteries lose flexibility. They stiffen. They narrow. Blood doesn't flow as efficiently. And suddenly you have cold feet, numb toes, cramping calves when you walk, that heavy, aching feeling in your legs. You might have even been told you have peripheral artery disease. But here's the part most people are never told. Even when plaque exists, blood flow can still improve if the vessel lining starts working better. That's the missing conversation. And that's exactly what happened with one of my patients. Her name was Margaret. She was 68 years old when she came to see me. Intelligent. Independent. Strong. A retired nurse who had spent decades caring for others, and now she was frightened. Her feet were constantly cold. Not mildly cool, deeply cold. Even under blankets. Then came the numbness. Then the pain when walking. She could walk 2 blocks. Then 1. Then barely to the corner without stopping. She was terrified because her father had suffered the same condition. He had ignored the warning signs. It progressed. It ended badly. Margaret wasn't just afraid of pain. She was afraid of losing her independence. Afraid of losing a limb. Afraid of becoming a burden. And the medications she was taking were only doing so much. When I reviewed her records, I noticed something surprising. There was extensive imaging. Extensive testing. Medication adjustments. But almost no conversation about supporting the health of the artery lining itself. That's where we began. And what I recommended to her might surprise you. But before I explain that, you need to understand exactly what's happening inside an inflamed artery, because once you see it clearly, everything will make sense. Before I told Margaret to change anything, I needed her to understand what was actually going wrong inside her body. Because when you understand the mechanism, you stop feeling helpless. You start feeling empowered. Here's what most people imagine when they hear poor circulation. They picture a pipe clogged with debris, like a kitchen drain blocked with grease. And yes, plaque buildup inside arteries is real. But that's only part of the story. Your arteries are not rigid pipes. They are dynamic, living structures. The inner lining of every artery is made of a thin layer of cells called the endothelium. These cells are incredibly intelligent. They constantly sense blood flow, pressure, oxygen levels, and they respond. One of their most important jobs is producing nitric oxide. Nitric oxide is a signaling molecule that tells your arteries to relax and widen. When your vessels relax, blood flows smoothly. Oxygen reaches your muscles. Your feet stay warm. Walking feels easier. But when the endothelium becomes inflamed or damaged, nitric oxide production drops. And this is where the real trouble begins. Without enough nitric oxide, arteries become stiff. They can't dilate properly. Blood flow decreases, even if the blockage isn't severe. This means someone can have only moderate plaque but experience significant symptoms, because the vessels themselves have lost flexibility. Now what damages the endothelium? Chronic inflammation. Oxidative stress. High blood sugar. Smoking. Poor diet. Years of silent irritation inside the artery wall. Over time, LDL cholesterol can become oxidized, damaged, and that triggers an inflammatory reaction. The immune system rushes in. More inflammation builds. The lining becomes dysfunctional. It becomes less responsive. Less protective. More prone to clotting. So while medications may thin the blood or lower cholesterol, they don't always fully restore endothelial function. That's the missing link. When Margaret came to me, she wasn't just dealing with narrowed arteries. She was dealing with arteries that had lost their ability to relax. Her vessels were rigid. Her circulation was sluggish. Her feet were cold not only because of blockages, but because her arteries had forgotten how to open. And here's something important: endothelial cells can recover. They are resilient if you give them the right support. There are natural compounds that reduce vascular inflammation, decrease oxidative stress, improve nitric oxide signaling, support healthier blood flow. These compounds are not experimental. They've been studied extensively. But they're rarely discussed in routine appointments because they don't come in a prescription bottle. When I explained this to Margaret, I could see something change in her expression. For the first time, she understood that her body wasn't simply failing. It was inflamed. And inflammation can be influenced. Now the question becomes: what specific natural compound can reduce vascular inflammation, protect against oxidative damage, and support nitric oxide production, all at once? That's what I introduced next. And it may already be in your kitchen. When I finally told Margaret what I wanted her to try, she looked at me the way many patients do when something sounds too simple. She expected a new medication, a referral, a complicated protocol. Instead, I asked her a very basic question. Do you have whole cloves in your kitchen? Yes. Cloves. The small, dark brown spice buds most people associate with holiday baking. Here's what most people don't know. Cloves contain a bioactive compound called eugenol, and eugenol has been studied for its powerful effects on inflammation, oxidative stress, and vascular function. Now let me be very clear. Cloves are not a miracle cure. They are not a replacement for prescribed treatment. And they do not magically dissolve plaque. But what they can do is support the biology of your blood vessels. And that matters. Eugenol has been shown in research to reduce inflammatory signaling inside blood vessel walls, act as a potent antioxidant, helping protect LDL cholesterol from oxidation, and support nitric oxide activity, allowing vessels to relax more effectively, to mildly reduce platelet aggregation, supporting smoother blood flow when inflammation decreases and nitric oxide signaling improves. Arteries become more responsive, more flexible, more functional. And even a partially narrowed artery can carry significantly more blood if it can properly dilate. That's the key most people miss. It's not always about eliminating plaque, it's about improving function. Now, why whole cloves instead of a supplement? Because nature packages compounds in balance. Whole cloves contain fiber, volatile oils, and supporting plant compounds that modulate how eugenol is absorbed. Supplements can be overly concentrated and may irritate the stomach or interact unpredictably. I prefer simple, controlled, whole food delivery when appropriate. Here's what I suggested to Margaret: every morning, take 2 whole cloves. Place them in your mouth. Chew them slowly and thoroughly until fully broken down. Then swallow. The taste is strong, warm, spicy, slightly numbing. That numbing sensation? That's eugenol being released. It takes about 30 seconds. That's it. No complicated preparation. No blending. No expensive powders. Just consistency. Now let's talk expectations. This is not instant. You are not flipping a switch. You are gradually supporting endothelial recovery and reducing chronic vascular irritation. And when done daily, those small biological shifts can accumulate. Margaret committed fully. She didn't skip days. She didn't double the dose. She simply stayed consistent. Within 2 weeks, she noticed something subtle. Her feet felt slightly warmer. Not dramatic. Not life-changing. But different. By week 3, the difference was unmistakable. And that's when we knew something important was happening. But the real change came a few weeks later, and it surprised even her. By week 3, Margaret wasn't imagining it anymore. Her feet were warmer. Not perfectly warm. Not like she was 25 again. But noticeably different from the deep, icy cold she had lived with for nearly 2 years. And when you've been suffering for that long, even a small improvement feels enormous. But here's what fascinated me most. It wasn't just temperature. It was sensation. Margaret told me one morning, "I can feel my toes better." That might sound minor. But numbness is often one of the most distressing symptoms of poor circulation. It creates instability. It makes walking feel uncertain. It makes you constantly check your feet, worried about injuries you might not feel. The fact that sensation was improving told me something critical. Blood flow was likely improving at the microvascular level, the tiny capillaries that nourish nerves and tissue. Because circulation isn't just about large arteries. It's about the smallest vessels too. When endothelial function improves, those tiny vessels become more responsive. They open more efficiently. Oxygen delivery improves. Nerve tissue gets what it needs. Around week 5, Margaret tested something intentionally. She walked her usual route. Before starting this habit, she could barely make it 2 blocks before calf pain forced her to stop. That day, she walked 3 blocks. Then 4. Yes, she still felt tightness. But the cramping was less severe, and it resolved faster when she rested. Now, I want to pause here and say something very important. We did not stop her prescribed medications. We did not replace her doctor's treatment plan. We supported it. That distinction matters. Cloves were not acting as a magic fix. They were reducing vascular inflammation and improving vessel responsiveness, allowing the rest of her treatment to work more effectively. By week 8, the improvement was measurable. Her walking distance had doubled. Her nighttime discomfort had decreased significantly. She wasn't waking up at 2 a.m. to check her feet in fear anymore. And emotionally, something shifted. The fear that she was on the same path as her father began to loosen its grip. Because here's the truth about circulation problems: when you feel powerless, symptoms feel worse. When you see progress, your nervous system relaxes. And stress reduction itself improves vascular tone. By month 3, we repeated her circulation testing. There was objective improvement. Not perfection. Not reversal of every plaque deposit. But improved blood flow. Improved vascular responsiveness. And that's when Margaret cried in my office. Not because she was cured. But because she wasn't declining anymore. She was improving. Now here's the question you might be asking: was it really just the cloves? Or was there something else supporting this shift? The answer is, there were 2 additional nutrients I recommended alongside the cloves. And they play a powerful role in keeping arteries flexible. Now, I want to be very clear about something. Margaret's progress wasn't about one single spice acting like a miracle. It was about creating the right internal environment for her blood vessels to function properly again. Cloves helped calm inflammation and support nitric oxide signaling. But we also needed to address something else that quietly contributes to stiff arteries over time: vascular calcification. As we age, calcium can slowly deposit into artery walls. When that happens, vessels lose elasticity. They become rigid, less responsive to nitric oxide, less capable of widening when muscles demand more oxygen. This stiffness is one reason many older adults experience reduced walking endurance even if blockages aren't severe. So alongside her morning cloves, I recommended 2 key nutrients. 1. Vitamin K2. Vitamin K2 plays a crucial role in calcium regulation. It activates specific proteins that help guide calcium into bones, where it belongs, and away from soft tissues like arteries. Without enough K2, calcium can accumulate in vessel walls over time. With adequate K2, that misplaced calcium is more likely to be redirected appropriately. Research has linked higher K2 intake with better vascular elasticity and lower progression of arterial calcification. For Margaret, I recommended a moderate daily dose within safe nutritional ranges. Nothing extreme. Nothing megadosed. Just steady support. 2. Magnesium. Magnesium is one of the most underrated minerals when it comes to circulation. It helps blood vessels relax. It supports smooth muscle function. It assists in regulating blood pressure. It even supports nitric oxide activity. Low magnesium levels are surprisingly common, especially in older adults. When magnesium is insufficient, vessels tend to constrict more easily. That means less flexibility, more resistance, and reduced blood flow. I suggested a gentle, well-absorbed form taken daily. Again, not excessive. Just consistent. Now here's what's important. These nutrients don't unblock arteries overnight. What they do is support vessel function. When arteries are less inflamed, less calcified, better supplied with nitric oxide supported with adequate magnesium, they respond better. And response is everything. Even a partially narrowed artery can deliver significantly more blood if it can properly dilate when needed. That's why Margaret's walking distance improved. That's why her feet warmed. That's why her nighttime anxiety decreased. We weren't attacking plaque aggressively. We were improving function. And improved function can dramatically change quality of life. But there's one more critical piece you need to understand before you try this yourself. Because cloves, while powerful, are not for everyone without consideration. And there are safety rules you absolutely must follow. Before you go to your kitchen and start chewing cloves tomorrow morning, we need to talk about safety. Because even natural compounds can have powerful biological effects. And when something influences inflammation and blood flow, you have to respect it. First, let's review the basic protocol clearly. Use whole cloves, not essential oil. 2 whole cloves each morning. Chew thoroughly until completely broken down. Swallow once fully chewed. Stay consistent daily. That's it. Now here's what you should not do. Do not take clove essential oil internally. It is highly concentrated and can irritate the digestive tract or even be toxic in excess. Do not dramatically increase the dose thinking more is better. More is not better. Consistency is better. Do not stop prescribed medications without speaking to your physician. Now let's talk about who needs caution. Cloves have mild natural blood thinning properties because eugenol can reduce platelet aggregation slightly. This is generally supportive for circulation, but if you are taking medications like warfarin, clopidogrel, Plavix, high-dose aspirin, direct oral anticoagulants, you should speak with your doctor before adding daily cloves. Not because they are dangerous on their own, but because combining multiple blood-thinning agents requires supervision. If you have surgery scheduled, stop using cloves at least 2 weeks beforehand and inform your surgeon. If you have a history of bleeding disorders, again, speak with your healthcare provider. Now let's talk about expectations. This is not an overnight fix. It is not a substitute for medical care. It is not appropriate for advanced limb-threatening ischemia without physician oversight. But for individuals with early to moderate circulation issues, cold feet, mild walking cramps, endothelial dysfunction, this can be a powerful supportive habit. And the key word is habit. Margaret didn't improve because she tried cloves for 3 days. She improved because she stayed consistent for months. Biology responds to repetition. Inflammation reduces gradually. Endothelial cells recover gradually. Vascular tone improves gradually. If you expect instant dramatic change, you'll quit too early. Instead, watch for subtle improvements, slight warmth returning, slightly longer walking distance, a faster recovery after rest to reduce nighttime discomfort. Small wins signal internal change. And when those small wins compound, quality of life can shift dramatically. But there's one final piece I want you to understand. Because the physical improvements Margaret experienced were only part of the story. The emotional transformation, the fear lifting, was just as powerful. And that's something many doctors never talk about. I'll explain that in the final part. There's something about circulation problems that people rarely talk about. It's not just the pain. It's not just the cold feet. It's not just the cramping when you walk. It's the fear. The quiet, persistent fear that your body is declining, and there's nothing you can do to stop it. Margaret didn't just suffer physically. She was living in constant anticipation of loss. Loss of mobility. Loss of independence. Loss of dignity. Every cold night reminded her of her father. Every cramp in her calf felt like a countdown. Every numb toe felt like a warning sign. When circulation problems affect your legs, they also affect your confidence. You stop walking as much. You avoid outings. You hesitate to commit to plans. You shrink your world. And the less you move, the worse circulation becomes. It becomes a vicious cycle. Fear, less movement, worse blood flow, more fear. What changed for Margaret wasn't only her blood flow measurements. It was her mindset. When she started noticing warmth returning to her feet, something shifted internally. When she walked 4 blocks instead of 2, something loosened. When her test results showed improvement instead of decline, hope returned. And hope is not just emotional. Hope reduces stress hormones. Lower stress improves vascular tone. Improved vascular tone supports better circulation. The mind and the arteries are more connected than most people realize. By 6 months, Margaret wasn't just walking farther. She was walking confidently. She returned to the farmer's market. She walked to her daughter's home. She stood long enough to cook again. She stopped checking her feet at 2 a.m. She stopped imagining worst-case scenarios. The blockages hadn't magically disappeared. But her vessels were functioning better. Her inflammation had decreased. Her arterial responsiveness had improved. And that was enough to change her life. Now I want to leave you with something important. Cloves are not a miracle. Vitamin K2 is not a miracle. Magnesium is not a miracle. But daily supportive habits, done consistently, can create measurable biological shifts. And small biological shifts can create major quality of life improvements. If you have cold feet, a leg pain when walking, early circulation problems, or stiffness in your arteries, you may benefit from supporting your endothelial health. 2 whole cloves. Every morning. Chewed thoroughly. Consistently. Alongside proper medical care. Alongside movement. Alongside appropriate nutrition. Support your body. Don't wait passively. Because decline is not always inevitable. Sometimes the body just needs the right environment to function better again. I'm Dr. Christina Serrati. If this information resonated with you, share it with someone who needs it. Circulation problems often stay silent until they're advanced. And remember, improvement begins with small, consistent action.